Hello everyone, it's Tim Spector here of the Zoe COVID study. Welcome back to another update. And it's a busy one because this week we've seen the largest fall in new COVID cases this year, which is great news. But so far this hasn't changed the number of people in hospital, so we can't be complacent. The great academic team at King's have come up with a new way of predicting what hospitalizations are going to be like in your area, and we'll be rolling that out soon. And we've also got a way of telling whether, if you've got cold-like symptoms at any point in time, what your chances of those symptoms are being COVID and just being a routine cold. So plenty to get on with. Let's dive deep into this week's data. And we can see that the total cases are still very high, but they do continue to fall rapidly. So 72,500 estimated symptomatic cases each day, and about 25,000 people of those are double vaccinated or triple vaccinated. Now, this is an 18% drop from last week, which is, as I said, the biggest we've seen, and is really great news because it's been high for a really long time. But remember that double vaccinated or triple vaccinated people are now making up about a third of those numbers, and that's gone up from last week. So now about 1 in 58 people have COVID, which is still very high, and means someone on that bus or in that tube compartment is quite likely to have COVID. And we've seen that the chances of someone transmitting it within a family are very high. Now let's talk about death rates, because we are still pretty high, just over 1,000 a week, and this isn't going down yet, and obviously that translates to over 50,000 a year. But put this in context, it's 3 times lower than it was this time last year when we were in the tier system, and it was about 3,000 a week. So although we have more cases, we're having very much less severe illness and death, luckily. Hospitalizations haven't really changed. They're around 834 a day, same as last week, and just over 1,000 on ventilators. Again, no change there. And so a bit of a worry. We do want to see that coming down to reduce the pressure on the NHS. Hopefully, as we see this lag between cases and hospitalizations, that will occur. Now, let's have a look at what the different age groups are doing around the country. And as we've discussed in the last few weeks, it is that under 18 group that have been generally driving these waves with school times. That's still coming right down, and from very high levels. And nearly all the age groups, as you can see from the graph, are now showing downward trends, except one, which is the 18 to 35s, which is showing a slight upward tick, nothing dramatic yet, and so hopefully that's not going to continue. And good to see the older age groups that I was very worried about, the over 50s, over 60s, looks like they're on a downward slope as well, which is really good news. So we do need to continue with a booster program, because not enough people are being vaccinated. And if you look at this graph, which shows up to the end of October, just a few days ago, what the situation was like, we can see that lots of people had their second dose, but relatively few who've managed to get that third or booster dose. And those you can see those differences between the blue and the red lines, which is really quite worrying, because some of those groups between the 60-year-olds and 70-year-olds is really not high enough. And we're going to still see hospital activity in that group if we don't get things moving faster. It's a bit unclear whether people are reluctant themselves to go forward, or there's some logistic issue. Government is saying there's no lack of actual vaccine, but there might sometimes be problems with local staff, and we'd love to hear your comments on any problems you've had locally in the comments below. And what's clear is you really do need that third shot to get lasting protection from COVID-19 and get that 95% protective effect, which really pretty much rules out chance of really severe COVID in most people. And it may be the government actually is talking about introducing needing a travel passport for people who've had all three, because in a way this is the new idea of what the full course should be. 2 vaccines is just a real partial course, just like we used to think the first dose was a partial one. So hopefully that's going to improve, and I think that's our way out of this problem. So let's now look at the regions, and we can see on this graph how we're doing. All the areas are coming down, which is great. There's only a relatively small difference between the worst and the best region across the UK, which is very different to what we saw a year ago, interestingly, when we had these massive differences between north and south of 5 or 6-fold. It's good to see areas like the southwest that had a lot of problems recently, a lot of pressure on their hospitals coming down, also northeast and southeast of England as well. Scotland's fairly level at the moment, but they are one of the lowest levels in the UK, so I'm not too worried about them at the moment. Now let's have a look internationally. And I feel like a broken record for the last 3 months saying that we are the worst performing country in Western Europe for the last 3 months because of high cases. Finally, we have lost our position on top spot. We have been overtaken by a whole host of countries, with others soon to overtake us. And these include Belgium, Austria, we've got Ireland, which had really severe restrictions, Greece, Netherlands, and probably within a week will be overtaken by Denmark and Germany. The more Mediterranean countries, France, Portugal, Spain, Italy remain in reasonably good shape at the moment, but it is worrying to see these surges in these other countries. And I think we believe this is due to the fact that the vaccination programs for those countries was lagging ours by about 3 months. And so they've had the benefit the last 3 months of having pretty good immunity from those 2 vaccine shots. And that's now starting to wear off. There could be other factors, of course, there always are. And the weather is another factor in this, as people getting together more or just getting fed up of some of those severe restrictions they had in those countries. But nevertheless, I think we're going to see that happening more in those countries that haven't yet got their booster program together. So we're seeing US being pretty flat now, and Sweden's also doing well. Now, the country to watch here is Israel, because again, they are really useful for us because they're ahead of us in the vaccine race. They were ahead of us in the booster race. They had a big peak in cases before they got their booster program sorted, but now I'm pleased to say they've sorted that, and their cases are really down and their admissions are really down. So that's good news for us if we can keep up, do better on the boosters than we've been doing recently. Now, a lot of these countries that have beaten us are actually, in terms of having worse numbers of cases, have higher vaccination percentages than we do. And if we look at this chart here, this is the share of the total population fully vaccinated, which I think is the way to compare countries, not arbitrarily on whether you take teenagers or not. And we can see, yes, while there's still a general correlation between high vaccination rates and low cases, with Portugal and Spain at the top there, you can see some of these under countries like Belgium, Denmark, Ireland the Netherlands, that have got higher vaccination rates than we have, are also having these problems with surges in new cases. So it really shows that double vaccination alone is not enough to really control this COVID-19 in the population. It's just so easy to transmit it, whether you've been vaccinated or not. Let's look at admissions across the world, hospital admissions due to COVID. And this is where the UK is still doing very badly, still the worst in Western Europe. We're about the same as the United States, which have done a lot better recently, as you can see from this graph. And we're still really not making major inroads into this, which is a real worry. Now, just to put it into context, similar to the US, but we have twice the rate of Netherlands and Denmark, and we have about 12 times the rate of Spain and Portugal, that are doing very much better than us. So we can definitely improve our situation and less problems in our hospitals, which are already facing problems. Now, on the subject of hospitalizations, the team at King's have developed a prediction model to calculate the rate of hospitalizations a week ahead. And they're doing this using your data and applying it with machine learning and putting it into local situations. And we'll be adding this to our regular reports and show you what's happening. And this is going to give an idea of whether your particular area has problems in its hospitals or not just looking nationally. It's also good to see where we were compared to last year. So where were you in middle of November last year? If we remember, we were in that tier system just before we went into full lockdowns. Cases were increasing, very much more restrictions than there were today. And we can see that last year's hospitalizations were about 64% higher than we are today. So there were 8,900 as of yesterday and 14,000 the same day last year. And that's despite us having half the number of cases last year. It was 36,000 roughly a day back then, whereas we're double that. Now, what's also good is to look at how those cases affect the regional hospitals, and this is the picture today, where for each region we've given you the number of beds available and how many are occupied by COVID. This has stayed fairly steady at about between 6.4% and 8.4% of all beds, which is a big strain on the health service, but it's not as bad as it was a year ago, if you remember, when we saw a range between 6.5% in the best performing regions like the east of England or the southeast, and up to nearly 20% in the northwest and Yorkshire of England, which were really facing problems. So we saw much more of a regional difference. Here it's more evenly spread this time round. So important to keep an eye on these figures, because we do know that certain areas do get under pressure much earlier than others. And hopefully this prediction calculator is going to help us in that regard. So we'll keep you posted. So hospitals are still pretty busy. They are trying to protect their staff and patients, and luckily haven't been the same spate of NHS casualties from COVID as there were last year, but everyone is still on guard. And I was surprised when I spotted a visitor to Hexham General Hospital in Northumberland on Monday who thought the general rules about hospitals didn't apply to him. If anyone came to our hospital and wasn't wearing a mask, I would just chuck him straight out. Oi mate, out the door. Look at here, everyone's wearing a mask. We're protecting everyone. I think these rules should apply to everyone in a healthcare setting, no exceptions. And my healthcare colleagues working on the front line and behind the scenes have been wearing them constantly for nearly 2 years now without complaint. Some of them really tight fitting and potentially difficult when it gets hot. And I think you need to respect those rules in healthcare settings. Even if you have ideas that are slightly deranged about not getting infected by people you know or trust, because we know that transmission is greatest actually in people you do know in a family situation. So I always wear a mask in hospital scenarios where there are lots of sick people and people who meeting sick people. I also wear them in public transport and in high-risk situations. And it's clear that getting out of this pandemic is a combination of getting the full vaccine course of three vaccines, plus some modest safety measures when it's obviously important to do so. Now, hopefully all of you know that vaccines or boosters do give you the best protection against severe COVID and going to hospital, but some people still believe that natural infections are better. Our data suggests that's not true once you get to 6 months and give you only about 65% protection. And our latest data show that it's not a gradual dropping off. It's an idea that 4/5 of people are really quite well protected for a long time. One in 5 people get virtually no protection, so can get another natural infection really very rapidly. And we're going to be talking a bit more about that in another video, which we'll put a link to at the end of this. Now, it just shows you it's a bit of a lottery that deciding whether you think you can be infected or not. So don't take a chance on that. Now let's talk a bit again about breakthrough infections, by which I'm talking about the infections you get after being vaccinated. And we do know that if you've had at least 2 of the jabs after 2 weeks after that, you are better protected than you would be just from a natural infection in most people on average. And it does wane by 6 months in many people, and we have realized that no vaccine is 100% effective, and so these breakthroughs are to be expected, and they're happening all over the world. An interesting paper came out this week in Lancet Infectious Diseases, where UK researchers had followed a cohort of about 600 people, of which about 160 had got COVID infections, and they saw how likely they were to infect their households, depending on whether they'd been vaccinated or not. And what it showed was that the people who had been fully vaccinated were still able to transmit the virus to their family. And it turned out your risk of being in a family and getting COVID if someone else had it, even if they were vaccinated, was about 1 in 4. So really high. And I think many of you will recognize how having kids or other family members in the house, it's really hard to avoid getting COVID, even if you've been vaccinated, because you're just with them a lot of time, and this virus is incredibly transmissible. Hopefully everyone got mild disease, but it does tell us how important within family transmission is, and how you can't be complacent that just having had a vaccine which protects you from getting infected in the first place and from getting severe infections means you can't pass it on to other people. We did think that protection was going to be greater. This study, it's still relatively small, but is the best evidence we have so far, is that unfortunately you will get mild symptoms, but you will pass them on. So it's absolutely not something to do if you've got those cold-like symptoms that you get that we've been going on about. You are likely to pass it on to your family if you're not really careful. And just to put some figures around this, on how many people in using the Zoe app are getting infected. Since September, so very recent ones with the Delta infection, we're seeing about 10.3% of people getting infected after a single jab, which we know is pretty ineffective on its own. 3.9% of people after the two vaccine shots, and only 1.5% who've had the third or booster shot. And I think it's important to realize that the ability to protect yourself and how you respond to natural infection or the vaccine is due to having a healthy immune system. And to have a healthy immune system, many things need to be in place, but what everyone can do is to have a healthy gut microbiome, and to do that you need a healthy, high quality diet which is going to feed those microbes. We can talk about that some more later on. But let's now talk about non-COVID respiratory illnesses. And with COVID so high, a lot of you are still wondering, how can you tell your chance of having COVID if you develop these cold-like symptoms, which we've been reporting for months are really impossible to tell the difference from a normal virus. And just to remind you, 73% of people who are still testing positive for COVID are having a runny nose, and we've got very common headache, sneezing, sore throat, and persistent cough. So based on that, you can't really tell. So we've worked out a way of tracking the two conditions together in the app, and give you a rough idea of various points in time what you're likely to, what your chances of, if you do have those symptoms, of it being simply a cold or being COVID. This is a rough guide. Of course, it doesn't replace actual testing for the viruses themselves, but I think it's important when everyone is establishing their risk. And overall, 1 in 4 of those of you who had any cold symptoms in the month of October had proven COVID on our app. And this is, I should stress, just based on the app users. So we haven't generalized it to the whole population as we normally do. That's slightly tougher to do, but it's on the people reporting. So it's down to you guys. This is for you. In October, you had a pretty high chance of that being COVID. But if you'd reported those cold symptoms back in June, it was only about 1 in 11. So we're getting like a 3-fold difference in risk in just a few months. And that's why it's important to know what the baseline levels are, both of the virus, cold viruses, and COVID. So we think this tracking is going to be a really useful tool for us. And no one's ever really tracked cold viruses on an app like this with such big group of people. So I think we're going to get some fascinating data. Who knows what we may be able to together conquer the common cold that's eluded scientists for a long time. So really important to keep logging this, and we'll give you more data as we get it. So in summary, cases are dropping fast, which is great. Hospitalizations remain high. We do need to think about still protecting ourselves in public, where densely populated places, with masks. Do realise that transmission can occur in the home if you've got these symptoms, and we do need to get these levels down lower before we get into the full winter and potential other problems. But I think this is some good news for once, which is really pleasing. So do remember to like and subscribe us, and that way you'll know when the next videos come. Do share our app with someone who may have dropped off the app early on, and tell them about all these new features and fun things we're doing together. We'd like to get some of that couple of million people back on the app that dropped off, and keep an eye on our website for details. And finally, stay safe and keep logging.